Welcome to Placidway Pulse. Today we are diving into a staggering reality. Um, 240 million people worldwide suffer from knee osteoarthritis.
Wow, that is a massive number.
Right, you heard that right. That is 240 million people staring down a future of, painful metal and plastic joint replacement surgeries. Endless physical therapy.
Yeah, and basically a permanent loss of natural mobility. It's rough.
It really is. But what if the secret to regrowing that lost cartilage and literally reversing the clock on your body's aging is already hiding right inside your own belly fat?
Wait, what? Belly fat. Okay, that is the ultimate plot twist. I mean, we spend so much time trying to get rid of it, and you're telling me it's basically the fountain of youth.
I am. I totally am. So today, our mission for this deep dive is to explore exactly how Japan has, quietly become the undisputed global hub for advanced, non-surgical regenerative medicine.
Which is just a fascinating topic, honestly.
Definitely. We're going to look under the hood of two internationally recognized facilities driving this revolution, Helene Clinic in Tokyo and Cell Grand Clinic in Osaka.
You know, it represents a profound shift in how we view the human body. Because we are finally moving away from treating the body like a broken down car where you just, replace parts like a mechanic.
Right, like swapping out a tire.
Exactly. Instead, we are starting to regenerate tissue like a biologist.
Okay, I am so ready to get into this. But right off the bat, I have to ask, if my own belly fat holds this ultimate biological cure, why do you have to fly all the way to Japan to get the best version of it?
Yeah, that's fair.
Like, why isn't my local doctor just offering this on a random Tuesday afternoon?
That is the million-dollar question right there. And the answer is entirely about regulation, because Japan completely flipped the script on how to govern medical breakthroughs.
How so?
Well, back in 2014, they passed the Act on the Safety of Regenerative Medicine, the ASRM. If you look at countries like the U.S., the FDA requires decades of red tape.
Decades. Literally decades.
Yeah, and hundreds of millions of dollars in clinical trials for biological treatments. The problem is, they're treating a living, adapting biological cell as if it were a static, mass-produced pharmaceutical drug.
Oh, like aspirin or something.
Exactly, like a chemical formula.
Right. Which means by the time a treatment finally makes it through that bureaucratic maze, an entire generation of patients has missed out. I mean, you're suffering right now, but the cure is stuck in a filing cabinet for 15 years.
That is the tragic reality.
Yeah.
But Japan recognized that this approach was just fundamentally outdated. They were actually spurred by Dr. Shinya Yamanaka winning the Nobel Prize for discovering iPS cells in 2012.
Oh, right. The Nobel Prize. That's huge.
Yeah. So the Japanese government created a fast-track conditional approval system. The Ministry of Health, Labor and Welfare, the MHLW, they allow top-tier medical centers to offer these therapies safely to patients right now.
As long as they're monitored, I assume.
Provided they are rigorously monitored, yes.
Okay, I get the appeal of cutting red tape, but I have to push back here for a second.
Sure, go for it.
If we're just talking about getting a biological treatment outside the U.S. or Europe, why can't you just go to a cheap clinic in Mexico or Panama? I mean, you see those ads everywhere on social media.
Oh, absolutely. Stem cells for a fraction of the cost, right on the beach.
Exactly. So why not just do that?
I'm so glad you brought that up because it is the single biggest and honestly most dangerous misconception in regenerative medicine right now.
Really? Dangerous how?
Well, those cheaper, unregulated overseas clinics are operating in what is essentially a medical Wild West. And because they want to cut costs, they frequently rely on what we call donor stock cells.
Donor stock, meaning they are taking cells from a total stranger?
Yep.
Like what, umbilical cord tissue from a random birth?
Yes, exactly. They use allogeneic cells, so they take these batches of cells from strangers, pool them all together, freeze them in tiny vials, and ship them out for general use.
Wow. That sounds incredibly risky. You're just introducing foreign biological material into your body.
Well, the risks are very real. I mean, you face the theoretical risk of immune rejection, transmissible infections.
Yikes.
Right. And here's the real kicker. You get highly variable cell viability because of the freezing process itself.
Hold on, does freezing the cells actually ruin them? I thought freezing preserved things.
Well, think about putting a fresh strawberry in your freezer.
Okay, sure.
When you take it out a week later and thaw it, what happens?
It's complete mush. It gets all gross and watery.
Exactly, it's mush. And that's because the ice crystals have literally pierced and ruptured the cell walls.
Oh, wow.
Yeah, a very similar thing happens to frozen donor cells. When they are thawed at those cheap clinics, a massive percentage of them are already dead on arrival.
That is wild. You're paying for dead cells.
Right, and Japan's framework completely bypasses this. Their focus is almost entirely on autologous cells.
Autologous. Okay, let me make sure I have this straight. So they are taking the fat from your own body, isolating your own cells, and giving them right back to you.
Exactly.
So your immune system doesn't attack them because it just sees, well, itself.
You totally nailed it.
Yeah.
There is zero risk of immune rejection because your body recognizes its own material. Furthermore, the MHLW requires type 2 certification.
Which means what exactly?
It means these cells must be processed in ultra-sterile, government-certified cell processing centers. We call them CPCs. It is a completely different standard of care from those unregulated pop-up clinics.
That makes total sense. So we know Japan has the safest, most progressive laws. Let's zoom in on the actual mechanics of it, the orthopedic miracle.
Let's do it.
How do these autologous cells actually repair a degraded bone-on-bone knee joint?
Well, first, let's be precise about that bone-on-bone label.
Okay.
Because while stem cells can offer meaningful pain relief for severe cases, the real sweet spot where we see the absolute best, most transformative outcomes is for patients with Kellgren-Lawrence grade 2 and grade 3 osteoarthritis. Yeah, that is the critical window where there is still enough cartilage remaining for the stem cells to use as scaffolding, to support active repair.
So the lesson is, don't wait until the house is completely burned to the ground.
Precisely. You need some of the structure left.
Right. But back to the extraction part. You mentioned belly fat earlier.
I did.
Why fat? Because I thought the conventional wisdom was that bone marrow was the gold standard for stem cells. I always picture doctors like drilling into a hip bone with a massive needle.
Yeah, that sounds awful, right? But that is outdated thinking. If we look at the science of adipose-derived stem cells, ADSCs, compared to bone marrow, the fat tissue is an absolute biological gold mine.
Really? Better than bone marrow?
Oh, completely. Prepare yourself for this stat. Fat tissue contains up to 500 times more mesenchymal stem cells than bone marrow.
No way. 500 times more.
It is staggering. 500 times. And because the harvesting process is just a simple mini liposuction under local anesthesia, it is vastly less painful and invasive than drilling into your bone.
I would take a mini lipo over bone drilling any day of the week.
Seriously. And there is a massive 2025 meta-analysis by Cow and colleagues that prove this. They pooled data from over 500 patients.
That's a huge study.
It is. And they found that these adipose-derived cells significantly improved pain and function for 12 months and beyond. The bone marrow subgroup actually fell short in comparison.
Okay, so you have these millions of fat-derived cells injected into your creaky, painful knee. What are they actually doing in there? Is it just padding?
No, not at all. They operate through 4 distinct mechanisms of action. First is rapid anti-inflammatory signaling.
Okay.
Within days, the stem cells secrete cytokines like IL-10 and TGF-beta that actively quiet the pro-inflammatory cascade that's causing your pain.
Whoa, stop right there. That was a lot of alphabet soup.
Oh, yeah. Sorry about that.
What is IL-10? And how is it quieting a cascade?
Fair point. Okay, think of your arthritic knee like a kitchen fire.
A kitchen fire, got it.
Your body's natural response is to sound the alarm and send in inflammatory cells. And that causes the swelling and the burning pain.
Right, the joint gets huge and hot.
Exactly. When you inject the stem cells, they release these specialized proteins, the cytokines that act like a biological fire extinguisher.
Oh, I love that.
Yeah, they literally spray down the flames and tell your body's alarm system to turn off.
That is a great visual. So the fire is out. What's the second mechanism?
Trophic cartilage protection. Basically, they release growth factors that act like a shield over your remaining cartilage, preventing further degradation. They stop the bleeding, so to speak.
Okay, so extinguish the fire, shield the remaining house. What's number 3?
Third, and honestly this is crucial, is immune system regulation. They reprogram the local joint environment from a state of chronic inflammation back to perfect homeostasis.
Meaning they aren't just giving you a temporary painkiller, like they are changing the actual environment of the joint so it stops attacking itself.
Yeah. That is the most important takeaway of all of this, yes. And that leads to the fourth mechanism, which is sustained pain relief. Because the environment is fixed, we are seeing studies where functional improvement is maintained for up to 5 years from a single injection.
5 years from one shot. That's incredible. This brings something to mind.
What's that?
A lot of you listening have probably tried PRP platelet-rich plasma for joint pain. But based on what you are describing, PRP is like shooting off a signal flare to ask for help. But cultured stem cells are the actual general contractors showing up to the construction site with bricks and mortar to rebuild the joint.
I absolutely love that analogy. That is spot on. It perfectly captures the difference in potency.
Right.
And just like you wouldn't hire a single contractor to build a 50-story skyscraper, dose matters incredibly in stem cell therapy.
Oh, I bet.
This brings us to Dr. Yuichi Wakabayashi at Cell Grand Clinic in Osaka. He has established a very strict, non-negotiable threshold, a minimum dose of 100 million highly viable stem cells per knee.
Why 100 million? What happens if you only inject, say, 10 million? Do you still get some benefit?
Below 100 million, the signaling cascade is just too weak.
Really?
Yeah, the biological effects become marginal. You might get a tiny bit of temporary relief, but you don't get the cellular remodeling. Dr. Wakabayashi won't even perform the procedure unless he can guarantee that 100 million threshold.
Talk about high standards.
Well,
So let's talk about these doctors, the actual pioneers executing these protocols. Who are the minds behind these facilities?
let's start in Tokyo with Dr. Takaaki Matsuoka at the Helene Clinic. His backstory is just incredible, and it brings so much humanity to the science.
What's his story?
In 2011, he actually survived thyroid cancer.
Oh, wow.
Yeah. And the surgical intervention was successful at removing the cancer, but he was left with severe, debilitating fatigue and a massive hormone imbalance.
You know, it's one thing to survive cancer, but it's another entirely to actually get your life back afterward. I mean, being told you are cured doesn't mean much if you can't even get out of bed in the morning.
Exactly the problem he faced. Dr. Matsuoka couldn't accept that diminished state of living. So, out of sheer desperation, he turned to the very medical innovations he was studying.
No way.
Yep, he used stem cell therapy on himself.
Wow. Talk about putting your money where your mouth is. He became his own test subject.
He did, and it completely restored his physical vitality to his pre-cancer levels.
That's amazing.
It is. That profound personal experience entirely shifted his medical career. Today, he is a leading authority on what is called the homing theory.
The homing theory. Okay, how does that work?
Well, when cells in your body are damaged or inflamed, they emit chemical SOS distress signals, specifically a protein complex called SDF1-CXCR4.
Let me guess, the fire alarm's going off again.
Yes, exactly. So when Dr. Matsuoka administers stem cells systemically, they act like biological homing missiles.
Oh, okay.
They automatically detect those specific distress flares in the bloodstream and navigate directly to the exact areas of the body that require repair.
That is mind-blowing. Your body is basically broadcasting its GPS coordinates to the repair crew.
Yep.
And the empathy Dr. Matsuoka must have for his patients, having been a desperate patient himself.
Yeah.
I mean, you just can't teach that in medical school.
Absolutely not. It's a lived experience.
So what about Dr. Wakabayashi over in Osaka?
So Dr. Wakabayashi brings a highly analytical, deeply scientific rigor to the field. He is dual certified by the American Board of Regenerative Medicine and the Japanese Society of Anti-Aging Medicine.
Very impressive.
But what is truly unique is his background. He is NIH trained with extensive experience in advanced PIA and SPECT imaging.
Wait, like radioactive brain scans?
The very same. He has spent years using radioactive tracers to track minute metabolic changes and amyloid plaque accumulation in the brain for diseases like Alzheimer's.
That's intense.
Very. So when he looks at regenerative medicine, he isn't just looking at a swollen knee. He is looking at cellular repair through an incredibly precise molecular lens. His entire clinical philosophy is built around one concept, which is healthy life expectancy.
Right, because nobody just wants to live to be 100 if the last 20 years of their life are spent confined to a wheelchair managing chronic pain.
Exactly. It is entirely about living with high vitality until the very end. And to ensure this, he instituted the Grand Stem Cell Standard at his clinic.
What does that entail?
It guarantees that the cells you receive are fresh, meaning never frozen so they don't turn into mush. Pure, meaning they are cultured without animal products to avoid contamination.
Okay, good.
Young, meaning they are multiplied within a strict number of generations before they become exhausted and lose potency. And finally, perfectly dosed, hitting that 100 million mark.
Okay, but wait. If injecting these cells into an isolated, sealed-off joint like a knee can literally regrow tissue and put out the fire.
Yeah.
What on earth happens if you don't restrict them to a joint? Like, what if you put those 100 million cells straight into the bloodstream?
That is the ultimate aha moment of this entire field. A huge part of this systemic revolution involves something called exosome therapy, specifically MSC exosomes.
Exosomes. I've been seeing that word pop up on literally every health and longevity blog recently.
Yeah.
What are they, in plain English?
Okay, think of exosomes as tiny messenger vesicles. If the stem cells are the factory producing the cure, the exosomes are the microscopic cargo ships they send out into the body.
Oh, cargo ships, okay.
Yeah, they carry incredibly potent healing proteins, genetic blueprints, and growth factors.
So they transmit the healing instructions without needing the entire physical stem cell to be there.
That is the brilliance of it. They utilize something called paracrine signaling.
Paracrine signaling. Is that like a localized broadcast, kind of like a Wi-Fi router, sending a signal to all the smart devices in your house, rather than needing a hard wire plugged into every single cell?
That is the perfect way to visualize it. And because they are so small and use this Wi-Fi-like signaling, they can be administered via systemic IV infusions.
Wow.
These IVs are opening up entirely new frontiers for treating massive systemic issues. Things like autoimmune diseases, diabetes, and even erectile dysfunction, or ED.
Wait, ED. Going from a bad knee to treating erectile dysfunction is a massive leap.
It sounds like a leap until you realize that biologically everything is connected.
Okay, how so?
Well, the sources provided an incredibly illuminating case study. There was a 49-year-old businessman from Singapore who traveled to Osaka specifically seeking treatment for ED and severe fatigue.
He probably thought he just needed a quick, localized fix.
Oh, he definitely did.
What did the clinic find out when they actually looked under the hood?
Through comprehensive testing at Cellgrain Clinic, they discovered his ED wasn't an isolated mechanical failure at all. It was a holistic vascular issue.
Oh, so the pipes were clogged everywhere.
Basically, yeah. They found early signs of a fatty liver and a small carotid plaque in his neck. His entire vascular highway was fundamentally compromised by silent systemic inflammation.
Oh my gosh, so the ED was just the canary in the coal mine.
Yes,
His body was giving him an early warning sign for a potential heart attack down the road.
exactly that. Traditional medicine would have just prescribed him a pill to force blood flow and mask the symptom.
Right, like a Band-Aid.
But instead, Dr. Wakabayashi used high-dose autologous stem cell 5E infusions to treat the absolute root cause.
What did the IV do?
The stem cells acted systemically to improve overall blood flow, repair the damaged vascular lining throughout his body, and dramatically reduce his systemic inflammation.
That is incredible. They didn't just fix the immediate complaint. They essentially remodeled his entire circulatory system.
Precisely. And there's another story that really caught my eye. A 60-year-old man from Indonesia who was treating long-term diabetes.
Oh, right. Another perfect example of systemic repair.
Yeah, he was suffering from chronic lower back pain, severe fatigue, and a complete loss of vitality due to the cellular damage caused by his diabetes.
That's so draining.
It is. He told the doctors he didn't just want a new drug to manage his daily blood sugar numbers. His exact quote was that he wanted the energy to live actively again.
Because life is about what you can actually do, not what a lab chart says.
Right. And after undergoing his custom stem cell IV therapies, his inflammatory markers plummeted.
Really? Just from the IV?
Yes. His numbers stabilized to the point where he safely reduced his traditional medication. And most importantly, he actually regained the physical energy to travel and enjoy his life again.
If we connect all of these stories to the bigger picture, it really highlights something amazing. These treatments aren't about masking pain or managing decline.
No, not at all.
They are completely reprogramming the body's local immune environment from a state of chronic alarm back to perfect, peaceful homeostasis.
You are resetting the biological baseline of the human body. That's what's happening.
So what does this all mean for you, the listener? Bringing all this high-level Nobel Prize-winning science down to earth. How do you actually experience this?
It's surprisingly easy, actually.
Let's talk about the logistics of this VIP medical tourism experience. Walk me through it. I am booking my ticket right now. What happens on trip 1?
Okay, so the standard protocol for autologous cells is what we call the 2-trip timeline.
2 trips, got it.
Trip 1 is very quick. You fly into Japan, say, into Kansai International Airport for Osaka for a long weekend. You have your direct in-depth consultation with the doctor in English.
Which is super helpful.
Very. And then you undergo the fat harvest. It is a minor 30-minute mini liposuction procedure done right there under local anesthesia.
30 minutes.
Yes.
Seriously. I spend more time trying to figure out what to watch on a streaming service. And then what? I have to sit in a hotel room for a month to recover?
Not at all. You literally walk out the same day. Most patients just fly back home.
Oh, wow.
Yeah, and while you are back at your desk going about your normal life, your cells are sent to that ultra-sterile Japanese CPC lab.
Oh, so they doing all the heavy lifting in the lab while I'm back home.
Exactly. Over the next 4 to 7 weeks, they are meticulously cultured and multiplied from a few million cells all the way up to that 100 million magic number.
Then what happens on trip 2?
For trip 2, you fly back to Japan, the cells are ready, you receive the simple intra-articular injection into your joint, or you just sit back for the systemic IV drip.
That sounds incredibly simple. And from what I read, the experience itself sounds incredible. Like, we're not talking about sterile, depressing, fluorescent-lit hospital wards here.
Far from it. These clinics are designed with a calming, modern Japanese aesthetic. Cell Grand Clinic in Osaka, for instance, is located right above a Fendi store on the famous Midosage Street.
Above a Fendi store, that is luxury.
Right. They offer luxury, private recovery rooms that feel infinitely more like high-end spas than a medical facility.
I could definitely get used to that.
And because all of these procedures are outpatient, patients very often combine their trip with world-class shopping in Ginza or, sightseeing the ancient temples in Kyoto.
That sounds like an amazing vacation on top of the medical care. But okay, let's talk about the elephant in the room, the financial reality.
Let's do it.
Because we are talking about custom culturing your own cells in a high-tech Japanese lab. This level of personalized, scientifically advanced care cannot be cheap.
No, it is a significant investment. For localized treatments, like injecting a single knee joint to regrow cartilage, you are looking at roughly $6,500 to $13,000.
Okay. And for the full body, systemic IV upgrades.
So systemic IV packages for anti-aging, diabetes, or severe autoimmune conditions are much more comprehensive because they require vastly more cells.
That makes sense.
Those generally range from $22,000 up to $64,000 or more, depending entirely on the number of sessions and the complexity of the cell expansion protocol required for your specific body.
So what stands out to you, when you actually sit down and calculate the hidden costs of a traditional knee replacement?
Oh, yeah.
The massive insurance deductibles, the months of agonizing physical therapy, the lost wages from taking time off work,
Right.
not to mention the ongoing prescription pain management. Doesn't an upfront investment in your own cellular regeneration suddenly seem incredibly practical?
It really does. It is a total paradigm shift in how we value our long-term health.
Yeah.
You are investing in biological restoration rather than mechanical replacement.
Exactly.
And when you factor in the rigorous safety standards of Japan's MHLW, you're ultimately paying for peace of mind. You know you are getting the highest quality, safest treatment on the planet.
It really is the ultimate investment in yourself. So, as we wrap up this deep dive into the world of Japanese regenerative medicine, what is the one big takeaway we should leave with?
I want to leave everyone with a slightly mind-bending concept.
Oh, all right, lay it on me.
For decades, humanity has spent billions of dollars trying to freeze time with synthetic chemicals, invasive surgeries, and artificial plastics. We've been looking outward for the cure.
Constantly.
But if the ultimate fountain of youth, the biological blueprints to heal our joints, repair our organs, and rejuvenate our skin, has literally been hiding inside our own discarded body fat this whole time, how will that completely redefine our relationship with our bodies in the next 10 years?
Wow. That is profound. Our own body holds the cure. We just finally figured out how to unlock it. Head over to placidway.com to start your own journey. Subscribe to Placidway Pulse so you never miss an episode, and share this with a friend who needs to hear it.